Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, what makes for a good story when it comes to public health? I'm joined by Monica Wang, an associate professor at the Boston University School of Public Health, an adjunct professor at the Harvard T.H. School of Public Health, and the author of a new book called The Collective Cure: Upstream Solutions for Better Public Health. We talk about the basic elements of storytelling and how it can be used as a powerful tool in public health advocacy and outreach. Let's listen. Monica Wang, thank you so much for joining us on Public Health on Call. How are you?
I'm doing great. Thanks for having me.
Of course. So we are going to talk a little bit about your book, The Collective Cure. But before we get into that, would you tell us a bit about you and your work?
Yes. So my parents immigrated to the U.S. when I was very young. They both came from food insecure backgrounds. And for them, education was the path towards success and stability. And growing up, they weren't able to afford to send me to private school, but they looked for the best public schools available. And I grew up in Boston, and they came across a program called METCO, which is one of the longest standing voluntary school desegregation programs in the country. So from elementary through high school, I lived in Boston and I bused to Belmont, which is a predominantly white and wealthier suburb. And even though these two neighborhoods were only 10 miles apart, they could not have looked and felt more different. So in Boston, I lived in rent-controlled housing, and there were lots of fast food restaurants and corner stores, not a whole lot of fresh produce or grocery stores around. We lived by a major artery road, so there was a lot of air pollution from buses and vehicles, and it wasn't always safe to, play around in the playgrounds or bike. Whereas in Belmont, there were plenty of bike lanes and walk paths. There were a lot of trees that offered a lot of shade, and the air quality was better. And not only were the neighborhoods environmentally different and economically different, they were also different racially and also different health-wise. And it wasn't until graduate school where I learned about structural housing, segregation, and redlining, and policies that contributed to neighborhood health disparities that led me to pursue a career in community health and public health, which is where I am today. I pursue work that really works with communities around designing solutions. And so moving from understanding exposures and how they're linked to health outcomes to really how can we produce change and how can we design and deliver interventions that make a difference.
And I feel like you've already sort of set the scene here with this amazing story about your background, but you study storytelling and science. So tell us how these things kind of work together in your world.
So this work actually started from two directions that eventually came together. Part of that work came directly from early in my career. I sat down with kids and with families and community members, and I asked them, tell me what motivates you around different health behaviors and your experiences. And what stood out to me was really the stories that they told, and that was more persuasive than any data set I could present. And it also, in having conversations with people, it makes you come out of the academic jargon and really start to unpack abstract concepts into something tangible that people can really understand and feel. And then on the other hand, I had a mentor early in my career who really encouraged me to think beyond academic publishing. So we often think about impact factor, and she encouraged me to really think about impact to society. So how do you write op-eds? How do you engage in science communication and communicate these findings to decision makers like policymakers or business owners? And that was a turning point for me. It pushed me to think about not just generating evidence, but how can we help that evidence travel consistently to people who can hear it and trust it and who can make decisions to lead to change?
And when you're thinking about, what kinds of impactful things to talk about, what makes for a good story?
So I didn't learn this until maybe a few years ago when I started to do work around narratives and narrative change. And I worked with many people in journalism and a writing coach. And what I learned was there's two parts to storytelling. One is the anatomy of a story, and the other is the art of storytelling. So the anatomy is the structure. And there's three core parts. One is that you want to start a story with a relatable character or moment. So something that feels familiar or recognizable, even if it's not someone's own experience. And then we really want to highlight a tension or a struggle. So if you think about all the books or the TV shows or the movies that we gravitate towards, we're rooting for the underdog. So someone who's experienced conflict or some kind of barrier. We're not rooting for somebody who's had everything easygoing in their life. And then finally, a strong story is one that you connect the experience to an action or a shift in understanding. And so that structure is what helps a story land. And then the art of storytelling is just as important because the delivery can really make a difference. And that's how the tone of the story is crafted, the pacing and the values that you choose to reflect. So part of being a good storyteller is also really understanding your audience. So sometimes when I'm meeting with different audiences, I'll start with a different character or a different moment, or I'll highlight different kinds of values depending on the audience. And that can really improve and emphasize the emotional connection that you really want to create. And in public health, when we bring those two together, the stories can be really powerful in helping people see themselves in the issue, they see themselves in the data, and then reconsider what they thought they knew. And that's what often opens the door to new understanding.
So you mentioned data. In public health, obviously, we're thinking very much about the collective, but you're talking about individual stories. How do you bridge those?
One way to do that is you pull the data through the story. So in my book, each chapter opens up with a story from a different character. One of the women in my book, it's my journey as a woman, as a working mother, as a busing student. And then there's three other women that I interviewed across the United States. And so each chapter opens up with a moment in our lives where a different social or structural factor impacted our health. And then through that story, I pull through the data. And so one example would be, for example, Maria Liz, who's a first-generation Latina college student. And I would share a story about her struggling with financial insecurity as a college student. And then I would say her experience was also experienced by millions of other students that year across the United States. And so that allows the reader to really picture what's happening, but then to also understand the magnitude and the scale. That is not just one story or one anecdote, but a larger pattern of how a particular policy or program or structural factor is really impacting health. And that story allows us to create an entry point to make these abstract concepts tangible and to understand and to help people understand not just what the data show, but why it matters.
And so when you're writing a book about people and sharing their stories, I'm sure you had conversations with them about how their stories would be used, who might read their stories. Can you tell us a bit about, when you go into using storytelling, particularly for like policy and things like that, where people may be in very vulnerable situations and you're sharing information about them, how do you think about protecting them, making sure that they're comfortable with how things are used?
That's a great question. So whenever I share stories or I know that I'm going to be talking about people's stories, I always ask permission for people in what they're comfortable with me sharing. And most of the time, people are very happy to have their stories shared and told. Sometimes they will only prefer that I use their first name or perhaps a pseudonym. And other times, people are very happy to have all of their identities disclosed. And so sharing permission and asking for that is one way. And if you're not quite sure, you can always leave out identifying details. So it's not so much about the exact person or their exact age or context, but really about the conflict or the tension or the barrier that's in place. And that people can understand no matter what specific area or place or circumstance.
And so can you tell us a bit about, how storytelling can be used to kind of open the doors of science? You sit within some pretty prestigious institutions and you're talking about impact and writing a book outside of academia. Tell us about how story can be an entryway into this.
I think in many ways, storytelling is a way to build trust because stories really emphasize how our daily lives are impacted. So when we publish data in academia and we talk about how specific policy impacts lives, it still tends to be very abstract. We'll speak in large numbers, we'll talk about estimates and p-values, but there's not a whole lot of room in academia and in peer-reviewed publications to really say, this is what it looks like for a single parent household in rural Alabama for how they deal with the day-to-day in terms of getting kids to school, making ends meet, getting groceries, and even being able to sign up for a primary care doctor when there's a shortage and there's a months-long waiting list. So storytelling can really be that bridge to help carry the evidence to people who need to hear it in a way that resonates. And it also allows people to unpack the everyday experiences at the community level because, in public health, we often talk about upstream versus downstream. And stories, I think, are that midstream because the communities are where policies meet everyday life. And so through stories, they can help us really unpack the evidence tells us what works, but good stories help us care enough to try.
Your book is called The Collective Cure. Can you tell us what does that title mean in this context?
So I thought a lot about the title, and I really wanted to be upstream at first, although there's at least one other book with upstream as the main title, so we had to think of something else. And we ended up going with The Collective Cure because the idea is that health isn't created or solved by any one particular individual or sector or system, like the healthcare system or the public health system alone. And if you think about it, what's not related to health? Transportation is related to health. The way we produce and grow food is related to health. Technology and the way we invest in AI is related to health. Economic decisions are related to health. And so much of our national conversation still focuses on individual responsibility in terms of what individuals should eat, but what happens when they can't control how much food costs or what's available, how much they should exercise, but what if they can't afford a gym membership or don't have access to? And so The Collective Cure is really helping the everyday person see, policymakers see, and business owners and leaders and managers see that everybody has a slice of the pie to own in terms of collective well-being. And so a collective cure means improving health requires collective action. So when we bring different sectors together, whether that's housing or business or healthcare or community organizations, when we bring them all together, each one can then contribute what it does best. So it's not putting all of the onus on healthcare or all of the onus on public health to solve all of the social and structural conditions that impact our health that we know from the science. And so one example of this is a story from The Collective Cure. There's a woman named Dorothy Oliver from rural Alabama. And in the place where she lives, called Panola, there's no broadband, there's no grocery store, there's no healthcare clinic. Many people don't own cars. And when the pandemic hit, she knew that her community would likely be left behind, even when the COVID-19 vaccine was made accessible. And she advocated to have mobile vaccine clinics come to her community. And that took a lot of willpower, but it worked because the community really trusted her. And as a testament to how much so, she was able to get her community over 95% vaccinated in 2021, when the state level vaccination rates in Alabama that year were 48%. And so if I had gone there, if Dr. Fauci had gone there, we would not have gotten the same results, even if we followed the exact same protocol. And so the Collective Cure also means valuing different kinds of expertise and local leadership, because ultimately, I think better health is something that, not that we deliver to people, but something that we build together.
So maybe a through line through all of your stories, including your own, is this idea of, there are structural things at play that can be solved through policy, that impact individuals. Is there a story right now that you're kind of itching to tell that you haven't gotten to dig into yet?
Ooh, that's a great one. Well, I'm debating between two stories. So one is one from my childhood. So When I was growing up, to save on childcare, my mom and dad worked different schedules. So my dad had the more flexible schedules. So he was able to do pick up and drop off and mealtime, myself and my brother. My mom worked a 3 p.m. to 11 p.m. shift on weekdays. And then on weekends, she often did double shifts. And so for most of my childhood, my dad was the primary caregiver during my waking hours. And, he's great at many things, but being a parent to a girl who's going through adolescence, that's hard for anyone. And I had a local librarian, and her name was Miss Sheila Scott. And she would set aside books for me every single week with a little Post-it note with my name on it. And she knew exactly what I liked to read. And I mostly like to read everything, but I really liked fantasy and, mythological creatures. And what I didn't realize until when I was older is that she would change the developmental age of the books to meet me where I was as I was going through puberty and adolescence and young adulthood. And that was so helpful to me because it helped me feel not as alone with all of these changes moving forward. And when my book came out, my publisher took the book to local libraries in Boston, and she was describing it. And afterwards, an elderly librarian came up and said, "I know this author. Her name is Monica, and I was her librarian." And so we got to reconnect. And she's come to my book talks, and she's still in support of my book. And so it's just felt really full circle for someone who's handed me thousands of books to know that she's read mine and she's still in support. And so one of the themes is that it really takes a village, and she was definitely part of that village.
That is a really special story. Thank you so much for sharing that. And by the way, shout out to librarians. They do so much. That is really, really nice.
Yes, and they're wonderful public health allies too.
For sure. Monica Wang, thank you so much for joining us, and thanks for sharing your stories.
Thank you, Lindsay.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.